next work session is the Mental Health Support Services Update. Mr. Sloan and Ms. Freed.
Hey, waiting on us. Let's have it.
All right. Mr. Chair, Vice Chair, members of the board, Dr. Casey, on behalf of Chesterfield County Community Services Board, would like to thank you very much for the opportunity to be before you this afternoon. Fortunately, I will keep my comments brief. For those of you that know me, know that that's a difficult thing for me to do. I am notorious for using 20 words when 3 will suffice. But I'm going to keep my comments kind of focused on two items this evening. First or both an express appreciation to the Board of Supervisors. First and foremost, I would actually like to ask the members of the Community Services Board if you all could please stand, and support staff if you guys could also stand.
Mr. Chairman, let's give them
Mr. Chair, I'd like to take this opportunity to really express my appreciation to the Board of Supervisors, first and foremost, and their thoughtful due diligence in appointing members to the Community Services Board. As you're aware, the Community Services Board system has been in the state of Virginia decades. And it is a citizen board that is charged with the oversight of the mental health support services system in Chesterfield County. And this is a hard working group of people that show up every month for the board meetings and do a lot of work in between. Not only do the board members participate on the parent board, there are 4 primary committees of the Community Services Board, which would be our Public Relations Committee. There are board members there that work very closely with staff to put together materials that speak to various topics of importance to the citizens of the county. The Public Policy Committee, this board works very closely with staff and also the state organization to make sure that we're keeping in front of our elected officials, both at the county level, state level, those items that the consumers of the Chesterfield County mental health system are most relevant and important for us to keep those issues in front of you. The Housing Committee. The Housing Committee is one of the newer committees, but it has been around and has made a tremendous impact both on the community and for consumers. We have worked with Better Housing, the Better Housing Coalition, to identify housing opportunities in Winchester Green, Winchester Forest, the Horner Project in Clover Hill District, the Colebrook Motel Project, and the goal there is to find that necessary housing that we hear so much about for folks that are suffering from a variety of mental health related conditions, and to provide stability in housing and so forth. We work very closely with our private partners in creating those opportunities, and the committee also does a really good job of providing some oversight and continuing to look at how we run our group home programs in the county as well. And from a housing opportunity standpoint, and don't quote me on these exact numbers, please, but I believe over the course of probably the past 5 or 6 years, we've identified anywhere between 50 and 70 individual units that are either in process or we've been able to place before. So we're very grateful for that opportunity. And then last but not least is the Finance Committee. We're very blessed. Mike Giancaspro has served as chair of that committee for a number of years. Mike and I are the old luggage of the group. It seems like we debate on which one of us came first, and it was like Noah and the Ark and then us. We've both served on the Community Services Board now anywhere between 12 and 13 years, I believe. But Mike has, as chairman over the years, has worked really closely with Kelly's staff, Danielle, and we dive into the numbers every single month. We look at all the sources of revenue. We look at where the private payers, we look at our accounts payable, receivables. We keep track of the reserve accounts. We watch that stuff very closely, which I think any citizen advisory organization should do. Any budget item that comes before the board has already been looked at and scrutinized very closely by our group. And so, just speaking to the hard work of our board members, and it's a tribute to, and the successes of that are really a tribute to all of you and the folks that you have chosen to be on our board, and it's truly a fine group of people. And the last thing I would like to just speak briefly on, when you think of this body truly as being one of the larger healthcare providers in the region. Currently, I want to say we have approximately 650 employees, and prior to the pay study, on an annual basis, this department, and if we think about the context and the statement that I'm about to make, because I know that you've all been aware that over the past years we have gone through tremendous change in how the state has given us some guidance on how to run things. We have implemented things like same-day access. We continue to work with crisis intervention training. We continue to work with Marcus alerts. There is a number of programs that come down that the staff deals with on a day-to-day basis. And throughout all of this time, Kelly and her team and the support staff have continued to find ways to get citizens closer to services faster. And they have dramatically moved that needle from the time someone is identified as having an issue to the time they're getting in front of somebody getting treatment. There was a point in time when I first came on this board, that could be a 90, 100-day gap. And now it's almost always either next day or within a week. So in the context of what I'm about to say, prior to the pay study and the very generous allocations from this board to this department particularly, we saw a peak of turnover rates close to 25%. So if you think of a 650-person healthcare system that is experiencing a 25% at its peak turnover ratio, the cost to train, hire, redevelop, and at the same time continue to deliver those excellent services to the citizens of the county, I think warrant just a tremendous accolade to that group. Now here's the good news. So while the peak was 25%, I believe the regular average prior to the pay study was somewhere between 18 and 22%, with a peak of 25. Between the pay study contributions that have come from this board and the really hard work that's going on behind the scenes in the department from a human resources standpoint, to on the back of the whole COVID issue, to reinvent kind of an HR element to create equity within the organization, we're now seeing turnover rates below 5%. That's tremendous, and the cost associated with that, obviously are tremendous. So those are the two things that I really wanted to mention to you. Both of those, just a very sincere appreciation for the tremendous relationship the county has with the department and the support. There are lots of organizations within the Commonwealth that wish they had the kind of relationship that we have. So with that, I will stop talking and I'll turn things over to Kelly.
All right. Good afternoon, Mr. Chairman, members of the board, Dr. Casey. I'm Kelly Freed, the Executive Director of the Chesterfield Community Services Board, also known as the Department of Mental Health Support Services here in Chesterfield. It is my pleasure to be here this afternoon to speak a little more about the services that we've been providing, some of our accomplishments over the last year, and just continue to talk about all the ways that staff are diligently trying to fulfill the mission, which is really to promote quality services that lead to better outcomes for all of the citizens here in Chesterfield. Just to speak a little bit about those that we served last year, we served almost 7,000 residents here in Chesterfield in FY23, which was an increase in all of our service areas over FY22, and really sort of the bouncing back after the pandemic. We resumed all of our in-person classes for prevention services. And so whereas in FY22 we had served about 5,000 residents in the community, we increased that to over 9,000 in the community. And of course, our social media presence is has a reach of over 1.3 million. We're doing daily posts in our early intervention services and our prevention services. There's mental health tips that are going out all the time in several of our programs. Also recognizing any of the, suicide prevention months or any of those things as well. So just really have a big reach out into the community. The services, when you look more at the numbers, we were about evenly split between those that received mental health services versus those with developmental disabilities, followed by the substance use services. And then I always like to just remind everyone that all of our services are fully accredited, and we have our next reaccreditation survey in the fall of 2024. Just to speak a little bit about our budget, we are one of the largest departments in the county, and so we have our revenue is about $56 million. The majority of that comes from Medicaid, Medicare, and insurance at about $26 million, followed by the county's contribution of $15 million, a little over $15 million, and then, of course, state and federal funds. Other payments are fee-based, and there are client charges, but all client charges are based on an ability to pay scale. Of the $56 million of our expenditures, the majority of our expenditures go to the services of those with developmental disabilities, followed by our mental health services, and then lastly with substance use disorders. We spend approximately about $5 million of our budget, roughly 10%, on administrative support, which is consistent with prior years. And I do want to point out that all of our additional funding requests for FY24 were covered with outside revenue. There was no general fund cost for those positions. Moving into a few of our key accomplishments. First of all, I'll talk about the Emotional Health Planning Program. This actually earned us a NACO award in FY23. This is a partnership with Robin's Hope, and really the program was developed for individuals with developmental disabilities who have experienced trauma in their lives. The Emotional Health Plan is a tangible tool utilized to help individuals and their caregivers understand the emotional response to trauma and how to better support them to prevent a crisis. We received a lot of positive feedback on this program from families and individuals who have participated in it, and they continue to run this program today. Special accolades here for Jessica Charters and Stephanie Williams, who are the staff that were behind the program here, of course, as I mentioned, in partnership with Robin's Hope. The last three items that I have listed here, if you will recall, over the last year, we approached the board about this time last year to allow us to receive funding from the Department of Behavioral Health and Developmental Services to actually develop and stand up all three of these programs. So I'm going to speak a little bit about each one individually, because just in one short year, we have a lot of outcomes that we can share, positive outcomes with these programs. But before I jump into that, I want to say that our biggest accomplishment over the last 2 years is that our department has won the county's Trunk or Treat event. And so we have some tough competition this year. There are other departments in the county that have it out for us. Social Services has made that clear. And I'm not sure if we can...
they were a strong number 2
They
last year.
were, I know, but we actually have the real Willy Wonka here in the audience. So anyway, I'm not going to ask him to stand, but... Anyway, we do have a great team here at Mental Health Support Services, and just to echo what our chair, Gibb Sloan, has already said, we can't thank you enough. Our workforce, what the PACE study has done, both Phase 1 and Phase 2, has just made tremendous impacts in our residential services, really across the board, in our ability to recruit and be able to retain staff. And so just want to make sure that we definitely expressed our appreciation today.
Kelly,
Yes.
I mean, we certainly know that the pay study was an important factor in helping the employees out, but there's another factor that's really important too, and that is leadership and the quality of the work environment that's created within the organization. You can pay people a lot of money, but if they don't enjoy what they're doing, or if they don't enjoy who they're working for, who they're working with, and the way it's being done, they're not going to stay. And so the pay, I think, has certainly helped us, but I also believe that the leadership and the environment that you're providing over there is equally as important. I just want to make sure we pointed that out as well.
Well, I appreciate that, and I'm going to introduce the team a little bit later, but it truly is a work of a lot of our leaders in the agency, so I appreciate that. Speaking a little bit about Recovery Academy, so as you know, we opened the doors of the Chesterfield Recovery Academy a year ago, August of '22, at the start of the school year. It really was sort of a build it as you go. We were looking for staff about this time last year. We were looking for students at the same time, and so really it took us several months to get the program up and going, but I am pleased to say that by the end of the year, we had 11 students who completed their current grade level, whatever that was, 4 that graduated from high school. And just the outcomes of this program have really been great. Of the students that we're talking about, over 63 course credits were earned during that short time period. 7 of the students entered into the workforce. There were over 170 hours of individual therapy and 80 hours of group therapy that were provided by the clinical staff, which then led to an outcome of over 44 months of sobriety with the students. I think one of the biggest highlights of the program, not the biggest, but probably pretty close, is Letty, the therapy dog. And so our lead clinician, senior clinician, Melissa Mariner, it is her dog that is part of the program and really has a tremendous impact on the students. That's been a great part of the program. I will say that just, again, we're only talking about a few short months. This program earned the VACO Best Large County Achievement Award this past year and is also receiving national attention because last week 3 of the students as well as the staff were invited to attend the White House. They were holding a youth recovery event and they had learned about our program through a national conference and invited our students to attend along with the staff. So at this time, I would like to ask Melissa Mariner and Justin Savoy. Melissa is the lead senior clinician and Justin is the program coordinator. They have done tremendous work standing up this program over the past year along with a lot of other staff, and so we just want to express our appreciation for all of the work that you've done. Our enrollment is already higher this year. They started right out of the gate with 13 students and are still conducting an additional assessments. They've also hired an additional teacher and an instructional aide as part of the program, and we are also bringing in additional peer recovery supports. So again, just can't say enough of how well this program has started off over the past year. So. Moving on to another big initiative, as of July 1, our Chesterfield County implemented the 988 Marcus Alert protocol process. And so the 988 is the National Suicide Prevention Hotline. It's been in existence under a different number for a number of years, but switched to 988 this past year. And how Chesterfield County came into play as of July 1 is there is an expectation as part of the Marcus Alert protocols that if calls come into 911 and they are considered lower level behavioral health calls that do not need a police response, that those calls be transferred over to the 988 call center. In addition, if there are calls that require some type of behavioral health response in the community, that we are using crisis clinicians as much as possible to go out into the community to provide a behavioral health response to those situations. Again, we just started, implemented our protocols. We spent the last year developing them across the county with a lot of county departments and key stakeholders. But as of July 1, I have some really great outcomes that I'd like to share. We have had 224 Chesterfield calls, this is during the months of July and August, that were handled by the regional call center, which meant they were lower level calls that could be handled by the call center, relieving those calls from not only the 911 police department, but also the Chesterfield Crisis Department. Of those calls, 11 calls were transferred from 911 to 988. Now, 11 calls may seem sort of low, but that really is consistent with what we're seeing across the region. What we're finding is if someone calls 911, they truly are looking for a police response in the majority of the time. So they really aren't appropriate calls to be transferred to the 988 call center. But for the most part, the majority of the calls have been handled by the regional call center. The most important statistic that I would like to share is that there have been 54 calls during the last 2 months that required a co-response. So again, that is crisis workers going out in conjunction with police. Police primarily make sure the scene is safe, and if it's safe, then the crisis workers are the ones that kind of take the lead in those situations to provide a behavioral health response. Of the 54 calls that have been or needed a co-response, 46 or 85% of those calls were able to avoid hospitalization by receiving a lesser level of care that was needed. And so that is really tremendous because the whole goal of the crisis transformation that's occurring across the state right now, you've heard of the governor's Right Help Right Now plan. This is part of that. It's really how do we free up, provide the behavioral health services again, in the community as much as possible to prevent hospitalizations, which then help in other ways. It reduces the amount of time that officers are in the emergency rooms. It's less cost involved in treating individuals, and just a better way to be helping individuals than to have to hospitalize them. So we are truly seeing great results in this area. I will say in a few minutes I'll talk about the back end. The one problem was getting individuals into hospitals, but the other problem is there are lots of people ready to be discharged and there's nowhere for them to go. And so we'll talk about that in a minute. But, part of this response, we started a co-response team. We have a second one that's in the process of being up and running. We're really assessing resources to determine how much are we going to need in the future, and that's really going to be based on demand. But what the protocols require is if there are no resources or if the co-response teams are working on other cases and aren't available to respond, that at least a response is handled by a police officer who has been trained in crisis intervention response. And so we continue to do those trainings ongoing with all of our public safety personnel. Actually, there's a class going on this week, and it's a 40-hour class, which really helps all of the officers, equip them with how to deal with situations involving individuals who are experiencing a serious mental illness. I'll say to date, I know it's way over 1,000 public safety personnel have been trained to provide this crisis intervention response. And so, we're well equipped across the county to be able to support individuals in need. I do want to give one example of what happens in a co-response because this is really a success story. So on July the 13th, our core co-response team responded to a family that was in crisis. This call was complex in nature as it included a family of 3 needing immediate community supports and resources. This family consisted of a mother, a father, and a 5-year-old daughter. The family was stated to have been evicted from their home and now living in the woods nearby where their previous residence was located. On this particular day, the temperatures in Chesterfield County were scorching, which exacerbated the family's medical and mental health needs. Chesterfield Police, our Chesterfield crisis clinician, they were able to go out and collaborate with fellow colleagues, community providers, and a housing specialist to provide the most appropriate means for the family. The co-response team was able to provide resources in the form of working with Chesterfield Protective Services, who were providing supports related to the 5-year-old daughter. There was community stabilization in the form of an agency called Care of Passion, who was providing temporary and immediate housing for the family, as well as providing the family with mental health supports to include mental health skill building, as well as crisis stabilization, and connecting the family with the CSB for ongoing mental health supports and case management. We were able to make sure that one of the adults in the family received appropriate medical treatment at a local hospital, not not for a behavioral health reason, but just for a medical reason. And during this time, they were also provided other crisis support in order to mitigate any type of behavioral health hospitalization for the family. The direct work with the community providers, Chesterfield Mental Health, and the police department enabled this family to be supported in a positive, collaborative, and successful way, and again, housing them when they were currently living in the woods. So it takes a lot of folks when we talk about providing a less level of care, or a less intensive level of care, such as hospitalizing somebody. We have to pull on the resources, and really that's what this co-response team is about. How do we serve this family, bringing in all of our community resources and averting or diverting from a hospitalization? And so this is one of the true success stories that we had just early on in the process. I do want to say a special thank you to Julie Cox. She is our Crisis Adult and Emergency Services Manager, as well as Corporal John Sawyer for the Police Department, because they have done excellent work in standing up the co-response team. As we get into, a little more of the numbers, September is Suicide Awareness Month, and so we just want to take a moment to acknowledge that and talk about how busy the staff have been participating in community events throughout the entire month. This slide really contains the total number of county-wide suicide-related police calls, and then, of course, we break that down according to attempted suicides versus actual suicides. And, of course, the orange bar in the graph represents the percentage of juveniles or calls that involve juveniles. And, of course, a juvenile being 18 years or younger. Yes, and then that's broken down by those two. While the overall total numbers and attempted suicides have fluctuated from year to year, we are, pleased to see that we're starting to see a trend down in the number of suicides, which is really good. And for 2023, the graph really only represents 7 months, so that's why it's a lot lower, but we are still seeing a lower trend in 2023. But what we'd like to point out is that according to the Center for Disease Control, individuals that are 85 and older are really the ones that are having the highest rates of suicide, and that's followed by the next age group down of those 75 to 84. In Virginia, in 2021, those in the age category of 75 to 84 had the highest rates of suicide, even exceeding the national average. So for this reason, the Chesterfield Suicide Awareness and Prevention Coalition has decided to focus their September Suicide Awareness Month campaign on older adults and the people that care about them. So key messages that have been in this month's campaign are depression and suicide are not a standard part of aging. So therefore, it is important to be aware of signs of mental health concerns and connect to help if needed. Being involved in meaningful, recreational, creative, and social activities contributes to positive mental health. And you are not alone if you are struggling with your mental health. Reach out for help. Resources are available. And so we have had information on our website. There have been radio ads. Hopefully you all have heard those on the radio. We have been providing information packets to primary care physicians in the community. There have been numerous presentations to organizations that serve older adults in our community. There's presentations to older adults themselves. We've had videos going throughout the month, and of course the social media campaign. To speak a little more specifically about attempted suicides as it relates to the services that we provide in the mental health department, though the previous slide talked about county-wide statistics, we know there's a number of attempted suicides and suicides that occur countywide, but only a subset of individuals may be receiving services through our department. It doesn't mean that those individuals are not receiving services from a private provider, but we would not have access to that information. And just to share, the areas where we see the highest number of attempted suicides are with children, also adults with serious mental illness, and also those with substance use disorders. And so in the graph, there was a spike in FY20, as we can expect during the pandemic. Also, we saw an increase in children in both fiscal year 21 and 22, but we are seeing a large decline in attempted suicides in our current year, or FY23. So we're really pleased to see about that. When it comes to children, the majority of the overdoses have involved substance use, and what we don't know is whether those were accidental because they were experimenting with drugs and just didn't realize that the impacts that would have, or if they were intentional. But this graph the good news that we have in this graph only reflects attempted suicides. We have had no completed suicides of any children over the past 5 years. We have had 8 suicides of adults over the past 5 years. And again, the majority of those were due to substance use, and whether it was accidental or intentional, we don't know. And so I'll move into the drug use that we're seeing across the county, or the drug deaths particularly. So in FY22, 81 people lost their lives in Chesterfield County due to a drug poisoning event. It does represent a 36.7% decrease over what we saw between 21 and 22. But of course, opioid-related deaths still account for over 85% of the deaths that we're seeing in the county. I will say that there has been an increase, about a 30% increase in deaths due to cocaine and methamphetamine, so that we continue to watch all of our drugs and how they're impacting folks. And really what's challenging is when it comes to a death, it's not unusual to see multiple drugs in a system when cases are reviewed by the medical examiner. The challenge with that is it doesn't necessarily mean that individuals knew they were using multiple drugs. It's just that the drug supply is so tainted now, especially with fentanyl, that's creating a lot of challenges and resulting in more deaths. Emergency department visits pretty much stayed stable between 21 and 22, but the deaths decreased, and those were emergency visits due to overdoses. We do believe that Narcan saturation is a factor, and that our harm reduction efforts are impactful. And what I mean by saturation is we have done a lot of work to work with other county departments. We work with libraries, we work with schools to ensure that folks are trained, understand, have Narcan available to them, so that if any situation occurs anywhere in any of our county departments, and of course we're still training the public and high-risk neighborhoods as well, but really getting that out there is really saving lives. Now, our concern is with some of the other drugs that are coming into play these days, like xylazine. Narcan does not work on that particular drug. And so that is a concern, that if we don't get control over some of that, then we may see some increases in deaths. But overall, collaboration has really been the key here in Chesterfield, and all of us working together. Our Substance Use Steering Committee is very active in the county with all of the county leaders that are part of that committee. And so we're just constantly in motion trying to keep up with what's going on, tracking it, and providing prevention and intervention efforts everywhere that we can. Because we were talking about opioids, I want to make sure that we talk a little bit about the Opioid Abatement Authority. And so really, because of some of the settlements with pharmaceutical companies over the last couple of years, localities throughout are able to benefit by receiving opioid abatement funding to be able to work in our localities to address substance use efforts. And so for this past year, Chesterfield County was actually approved to be part of 4 different grants. I word it that way because the first 2 that you see listed are truly ones where Chesterfield County is the fiscal agent and the leader for that particular grant. The first one is the receipt of $1.6 million to expand mobile outreach services in the community. That is actually a collaborative or a cooperative grant that involves Colonial Heights, Petersburg, and Powhatan County. We have strong mobile outreach in our community, but not so much in the other localities, and so we're going to be working with them. We're going to expand ours, but we're going to be working with them as well to help them develop outreach services to help their communities. We also received little over $82,000 as a planning grant. That is only specific to Chesterfield County, and that will help us evaluate models for what type of behavioral health facility that we will need here in the county. The next project is a little over $200,000 to expand Project Recover. Hanover County is actually the fiscal agent for that project, but we are partnering with them along with the City of Richmond to be able to benefit in that effort. And then, of course, the last grant that's listed here is $100,000 to assess the needs of pregnant and parenting women with substance use disorders. This is a grant where Henrico is actually the fiscal agent. However, we're partnering with Hanover, City of Richmond, and Henrico in that effort. Agreements, the status of kind of where we are right now, there are agreements that, have to be developed between all of these localities for each of these grants, and so all of that is in process right now. As soon as all of those agreements are in place, the Opioid Abatement Authority will release the funding at that time to the fiscal agents, and then that's where the real work will begin of implementing these initiatives. So I just want to say again to Mr. Holland how much we appreciate your role on the Opioid Abatement Authority and how that's helping us here in Chesterfield. So thank you. The last major program where we received funding over the last year is permanent supportive housing. And so as I said, we approached the board last year because we were able to receive about $700,000 from the Department of Behavioral Health to provide permanent supportive housing to 30 individuals. That's the amount of slots that they allowed us to begin with. And of course, when we receive this funding, it's really important because it not only covers 100% of staff salaries, it covers the client's rents, it covers damages if clients happen to have any damages to their living arrangements. It provides wraparound supports and services to be able to help them, help individuals maintain and their stable housing as well as their recovery. And then it'll also cover past debts for individuals that may have trouble obtaining housing because of some of the bills that they have in arrears. Just in a short amount of time, like I said, we developed this last year. We are seeing great outcomes. I have on here that 25 are permanently housed. I think we're up to about 28 now. And so we have the other two slots are slated for a couple of individuals, but we're still trying to find the housing for them at this time. But what's most important, if there have been zero evictions of any of these individuals who have been housed over the last year. 14 of the individuals have had no hospitalization, so that speaks to the services and supports that they're receiving. We've had 7 that have gained employment, so that's the key too. Stable housing is the first thing that individuals need. It's really hard to obtain employment and other factors if you don't have stable housing, and so this is really the first that we'd like to get in place, but we still work on helping individuals be able to continue in their recovery, which includes becoming employed, and so we're seeing great progress there. And it is not a requirement of this program to receive CSB services, but we are really developing the relationships and working with individuals, and we have way over half of the individuals that are receiving our services. I like to show this picture because this represents a couple who were one of the first to receive permanent housing, and they were living in a tent behind Target for I think about 10 years before they were able to receive this housing. So our goal is to be able to expand this program. We have been a little reserved in doing that up to this point because early on it's been difficult to find the housing stock. That's what we're really, having the most challenges with. And while you can place individuals in motels for a short period of time, that is not permanent housing. That is not ideal, and we did not want to grow a program if individuals were not indeed in stable housing. So we have not expanded it to this point, but as we're having developing relationships with landlords and having better luck with getting more housing stock, that's our goal, is to increase the program.
Mr. Chairman, I need to say that as some of you may know, Dr. Casey and I have gone out a couple of times, usually once a year, but sometimes twice a year, to visit and do our count with the homeless population in Chesterfield County. And I just want to say and express so much appreciation to you all for this effort, and also for the way that you've done it, because it's important that whatever help we offer not be a limited hand, but a full hand out and up, hopefully, over time. So I just want to express, again, gratitude, because the stories that you hear from folks in those tent villages behind various places in the county are often heartbreaking. People have been through a lot, and this is just an enormously positive thing for these families. And so I just want to say thanks.
Real quick, I just wanted to add that as we look at zoning cases, I know I've made a priority to talk to those applicants about opportunities for CSB placement, and I believe some other board members have done that as well. So we are working to try to help you to increase your placement ability. Where are you at on funding if we're able to increase placement ability? Is that which one is more?
The department, we'll have to approach the department to be able to increase our slots. They did provide us additional funding this year, but the slots did not come with that. So on the funding side, we do have some funding to be able to expand some services to our current.
So if we're able to get you some more slots, then you have the way to place them.
Yes,
Thank you.
Yes. I know we're running short on time. I'll try to kind of speed up a little bit. On partnerships, obviously, we cannot do what we do without tremendous partners, and so it's really important for us to make sure that we always thank them for what they do for us. But there's one specific partnership that I want to mention from this year. This is not specific to mental health support services. This is actually specific to our entire county. And so over the past year, Dr. Casey, Mary Martin Selby, and others began talking about how can the county better support all of our departments when it comes to secondary traumatic stress. So what secondary traumatic stress is, if you're not familiar with that, it's really the experience of people, generally professionals, who are exposed to others' traumatic stories as part of their work. And it may not just be stories. Fire departments, when they go out on very traumatic scenes. Police department are exposed to situations every day. Social services is exposed every single day. Our child advocacy center, it just goes on and on and on. And what happens is, as a result of this exposure, professionals can develop their own traumatic symptoms and reactions. And so, what we are really looking at is how do we better support our staff when, to make sure that we're assisting them if they're experiencing these types of effects. So as we started looking at what can we do across the county, we were fortunate to come in contact with Dr. Jenny Sprang from the University of Kentucky, who she is a professor of the Center of Psychiatry, and this is specifically dealing with the trauma with children. And what we found out is they had developed this breakthrough collaborative series, as they call it, which was a 9-month process where they could really work with organizations to increase their awareness of secondary traumatic stress, increase our capacity to plan and implement improvements to promote the wellness for staff, as well as reduce the risk of exposure to situations and events. What was even better was that they were under this grant. They had never worked with a locality before, and it was free to the county. And so they agreed to work with us, and over the past 9 months, I think we were planning for it about a year ago, but really kicked into gear as of January. We developed teams all across human services that had teams within their own department, so it's not just a few people. This is just really gaining momentum throughout all of our departments. We were able to receive baseline assessments to kind of gear how are we doing as departments as far as our staff's level of how much stress are they enduring, what are some things that do we have in our departments? What could we implement in our departments? And then they started providing day-long learning sessions for us. And so we had training sessions all throughout the year. We just finished our last one in September, but it's not just training sessions. They were giving us tools that we could use with our staff across the county to really help them in addressing secondary traumatic stress. I won't go through these, but this is just a few examples. There's been all types of training going on. The ULearn Chesterfield University has been developing all types of classes that staff can tap into to help them in managing stress. There was an idea about perhaps adding a clinician in the employee medical center to be able to have staff help staff depending on what's going on. There's wellness rooms and wellness tips and lots of things that we're doing. And what's really great is that we were able to do a pre-assessment and a post-assessment as part of this collaborative series, and we were seeing great results already in strategies that staff were using, being implemented, and the scores actually going down as far as the stress level of employees over time. I think what was most important about this initiative and what we're really hearing from staff is that they just felt great that people really realized this was a thing and that we were paying attention to that. And I think it's really been appreciative. I know that we really really focused the last 9 months on mainly the human services departments. The reason for that is that the public safety departments tend to have very detailed peer support programs. But there's a lot of other county departments that we want to reach over the next year and really help them with the strategies as well. And we've presented the department directors meeting and done other things to really start getting the word out. But there's more work that can be done here. So, our success story for the year, and it doesn't maybe seem like a success because the individual passed away, but what I would like to say about, to say a special tribute to Peggy Hanifer is, Peggy was probably, I think she was one of the first residents that ever came into our group homes. And so she was in our residential group home since 1979. So if you add that up, that's 44 years. And I really wanted to consider that as a success story. Peggy lived the majority of her life in our group home. She does have family support, strong family support. But she did pass away in June. She actually passed away on her actual birthday. Her health had been declining, and that picture is there because she just loved Mickey and Minnie Mouse, and one of her desires was to have the actual characters visit her on her birthday. Now, she passed away on her birthday, but we were able to arrange for the characters to come just a couple of weeks before her birthday, and she knew they were there, and she was really excited about that. And so, again, we just really appreciate Peggy's family for entrusting her care to us for the past 44 years, and just wanted to make sure that we kind of acknowledge that for them. So, as I get ready to close, this afternoon, we will be requesting the board to approve the receipt of one-time funding of $500,000. This is IT infrastructure that the Department of Behavioral Health is providing to us. How this started was they pitched community services boards, I think, in early February, just saying, hey, we have the ability to provide grants to you in amounts up to $500,000 because we are in the process of implementing a new information system, and that comes with a lot of other ancillary costs. We went ahead and submitted a proposal, and apparently a lot of other community services boards did not, and so they awarded us the full $500,000. And so that is on the agenda this evening. And again, systems don't come out, they just don't come out of the box. We have so many regulations. There are specific state-required forms that have to be built in these systems, and that's really what we're hoping to use a lot of this funding for, is to get those things built so that we are ready to go as we implement in July. As I close, I would like to recognize members of the senior team and ask them to please stand. We have Danielle Sayre, who's our Assistant Director of Finance. We have Doug Bilski, our Clinical Director. Mandy Pilk, who's our HR Manager. David Meadows, who is our Community Director. And then, of course, we have Dr. Angela Catalico, our Medical Director, who could not be here. Tim Adams, our Assistant Director for Strategic Planning and Quality. And then Brooke Cook. Again, these folks are the backbone of our organization. They head up all of these initiatives that I've talked about today and just really deserve a lot of recognition. So at this time, I'll entertain any questions.
Board members, questions or comments? Mr. Holland.
Mr. Chairman, thank you. I do have a comment or two. First of all, I wanted to thank you, Mr. Sloan and Ms. Freed, and all of you for being here today with us. Thank you so very much for the great work you do for Chesterfield County and our citizens. You don't know how much we appreciate your efforts as they truly impact families, and therefore it impacts us and me as a board member. And so I'm very deeply appreciative of that, and particularly that housing component. And certainly what I would like to leave with you is ask you if there's needs that we can do or assist with as a board as we contemplate budgeting. Maybe there's money we can put into the budget as we get ready for the budget for you in the areas of housing and other needs that you might have. Please let us know. Just tell us, and don't feel shy telling us as well. Do that as well. And also, as critically important, it's been a long-term initiative of mine for what you all have done for years, which is train our public safety personnel, our police department, and how they interact with citizens in our community who have mental illness and challenges. So I'm deeply appreciative of that, because I can tell you that's I've seen it like the Marcus Alert. I'm aware of how that came about, and it was probably a missed opportunity for a jurisdiction that didn't do it. But I applaud you all for doing that well and for making a difference, because it does matter. It truly matters. And thank you, and you have my complete support as you continue to do exceptional work here in Chesterfield County. Thank you.
Thank you, Mr. Holland. Anyone else? Thank you for a great report. Keep up the absolute fantastic work. And we'll see you after we adjourn here, I'm sure.
Thank you.